Maintaining a pH between 7.35 and 7.45 is critical for cellular survival and metabolic function. When an imbalance occurs, the body immediately begins to compensate to prevent life-threatening complications. Understanding how fast these systems react is vital for timely nursing assessment and intervention.
The lungs react within minutes by altering CO2 levels through ventilation changes to shift pH quickly. In contrast, the kidneys are more powerful but much slower, taking 24 to 48 hours to fully adjust bicarbonate levels. These differing timelines determine whether a patient is in a state of acute or chronic distress.
As a nurse, you must monitor arterial blood gas results to determine if a patient is uncompensated, partially compensated, or fully compensated. Identify the primary cause and observe the secondary system's response to ensure stabilization. Prompt recognition of these trends allows for targeted treatments that restore homeostasis.